Good morning, everybody. We're going to call this meeting to order. I want to thank you all for attending today and welcome our two new supervisors, Supervisor Cook and Supervisor Baca, for the first official meeting of their new term. And I guess your new term as well, Supervisor Rao. So congratulations to see everybody. And I know this place would be packed if we allow it to be packed with your fans and supporters, but it's a different change of times. We want to acknowledge the High Desert and Joshua Tree video conference sites as well. Thank you for joining us. And today we're going to be led in prayer and pledge by Pastor Noel Anderson. Pastor Noel is senior pastor for the First Presbyterian Church of Upland. He was born in Spokane, Washington. He spent his childhood years in Riverside and his teen years in Omaha, Nebraska. He's a graduate of Gonzaga University and earned a BA in English literature. Then went on to Princeton Theological Seminary, where he earned his master's in divinity with the emphasis in preaching. He's the author of a spiritual fiction novel, Those That Leap, and is married to wife Tara. Thank you so much, Pastor, for coming out and joining us today. We'll follow your lead. Can you all please rise?
Thank you for having me here. Please join me in prayer. Lord God, as we approach the end of a most difficult year, we start our day by acknowledging you. Unless we acknowledge your power and presence, we remain asleep despite what else we may do. You've created us in the world we enjoy in wonder and mystery. You have redeemed us again and again, saving us from ourselves and our more self-destructive tendencies. And you sustain us. Your Spirit regularly reawakens our consciences, both individually and collectively, and we find our moral compass realigned with true north. Thank you, O Lord, for your care. We appeal to your power for the many things that have made 2020 so stressful. We pray for reprieve from this COVID pandemic. How long, O Lord, will we wait? We pray for those who suffer its throes, and we ask for protection from its further spread. By your touch, heal all who endure present infection. Restore them to wholeness and health. Preserve us as well from the pandemic's residual effects, fear and paranoia on one hand, and an irresponsible disregard or rebellion on the other. Pour out a generous dose of wisdom on us all, that we may serve the common good of San Bernardino County in our best efforts. Lord, we ask mercy. Heal us of this plague. We ask for your help for a deeper illness as well. 2020 has been an onslaught of political stress, disunity, division, distrust, and a contentious public seemingly desperate to sort out information from disinformation, from the nonstop deluge of texts, tweets, and talking heads. Deliver us, O God, from our self-constructed bubbles wherein we reinforce ill-informed convictions. Open us to the possibility, the likelihood, that we neither know it all nor see all. Draw us to that higher ground of humility and patience. And Lord, today we especially pray for our leaders, who by your providence hold office. We pray for all public civil servants, for professionals who labor under vows. Empower them to spiritually fulfill their vows and protect them all as they serve our common good. Finally, we pray for just the next few weeks, for Christmas, for Hanukkah, Kwanzaa, and Lord, even Festivus. We pray that amid our many stresses, we would know and taste the goodness of the season. Sweetness, comfort, affection, warmth, kindness, and great generosity of spirit as we yet prepare to cross the threshold into 2021. Lord, let 2021 be a great year for San Bernardino County. And whatever comes, let us all always treat one another with love and respect, because we know you love each one with a love that appears to us to be infinite. Guide our actions and deliberations this day, we pray in your holy name. Amen. And now would you please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Pastor. Appreciate you coming out today. We're going to turn on to memorial adjournments. Does anyone have anybody? Supervisor Baca?
Hey, thank you, Chairman Hagman. What gives me a deepest sorrow, there's several members that have passed in the 5th District, but there's 3 members that were pioneers, civic leaders, and very significant in the community. The first one was a longtime Rialto resident, just passed recently here in November. His name was Jimmy Jews. And Jimmy Jews was a pioneer here in San Bernardino, the city of San Bernardino. He was a Rialto resident. But Jimmy was one of the first of 6 African-American police officers here in the city of San Bernardino. Jimmy was actually the first African-American firefighter in the city of San Bernardino and the first African-American fire captain. Longtime Rialto resident. He had a great family. He will be missed. The thing where it's become very personal for me is actually his granddaughter, Natalie Jews, was my history student at Rialto High School. So this one becomes very, very personal. And I know that Natalie was very proud of her grandfather and how involved he was in the community. He was very involved in the community, but just want to adjourn in memory. And Jimmy Jews, Rialto resident, passed at age 79. 2 other significant icons in the Inland Empire. The other one is Walter Hawkins. Walter Hawkins just recently passed of 72 years of age. And this one became personal for me because, my father attended Barstow High School and Walter attended Victor Valley High School. And they were actually rivals in basketball. So they were rivals in basketball. Walter came, he was involved in Cal State San Bernardino. He was part of the EOP program. He was an advocate for African Americans, primarily people of color, and he did a great job. And he also served on the Rialto Unified School District as a board member for several years. He was married to Jean Peacock. And where Jean is very significant to me is because Jean, his wife, was actually my wife's professor at Cal State San Bernardino. But Walter was also involved with the West Side Action Group, which is a very active group amongst the African American community here in the city of San Bernardino. And actually, I got to be on a call with Walter just a couple weeks ago, just a few weeks back. So I know he had health problems, but our hearts go out to the family and Jean Peacock and the entire Peacock family. And the last one, I believe Janice knew him, is Wayne Rubel. Wayne Rubel from Fontana. He had a middle school named after him. He was a high school teacher in Fontana, high school administrator, and then served for several years on the Fontana Unified School Board. And very active, a very nice man, very friendly man. His heart was always in the right place. And what was significant about that is my actually wife graduated from Fontana High School. So she was on the stage with him when she graduated from high school, and he was a school board member at that time. So we have several members to adjourn in, but those 3 members I really wanted to highlight. So thank you, Chairman.
Thank you, Supervisor. Supervisor Rock?
Our former supervisor for the 3rd District, Neil Derry, had his mom pass untimely and unexpectedly after a little bit of an illness. And we just wanted to offer our condolences from the entire county family to the Derry family. Thank you.
Thank you. Supervisor Rutherford? Supervisor Cook? I have one, unfortunately, this morning too. On November 17th, Elizabeth Nan Ryder passed away at the age 66. Now is a resident of Ontario. Was my former 4th District Planning Commissioner. Our condolences go out to her husband, Ken, and all who loved her. It's our honor to adjourn a memory for her today as well. Reports from County Council?
Thank you, Mr. Chairman. No items to report this morning.
Mr. CEO?
Thank you, Mr. Chairman. No items to report.
Great. We could start out today with a special resolution. I'm going to ask the board to come join me, if you can, up front, and ask Barbara Alejandra to come on up. We know behind every good man's a great woman, and she's the one who's been serving behind Ted this whole time, who's taking pictures. I don't know if you want to come join us, Ted, or not, but Barbara has proudly served the County of San Bernardino Superintendent of Schools in San Bernardino County for over 34 years. She has served as a COVID-19 liaison for 33 school districts in San Bernardino County to support the reopening of schools, which is no small task this year. She has served as a co-chair for San Bernardino County Community Vital Signs Initiative, engaged in community partners to collectively improve the health and well-being of the county residents. In her tenure, Barbara has been instrumental in implementing many programs such as the County School Strategic Plan, Veterans Diploma Project, Safe Routes to School and Footsteps to Brilliance, Early Literacy Platform, and many, many more. And of course, to give Ted all his good ideas when he's there and the superintendent as well, right? What a great power duo that we have in the county, serving the county residents for all these years. We want to thank you for your 34 years of service. And I don't know what you're going to do, but I'm sure you're not going to stay non-active. You'll be active in certain ways or not. Congratulations. Coming up. And Ted, do you want to come join, or are you just going to be taking pictures? You can maybe say a few words too if you like.
Thank you very much, Chairman Hagman and supervisors, Supervisor Rao and Supervisor Rutherford. Welcome, Supervisor Cook and Supervisor Baca. I have just had an amazing journey working in San Bernardino County and living here. I'm very proud of what we've been able to do. I have to share that the countywide vision has really brought us together in education. I felt like we were a little separate for a while, and through that vision, I have made the best of friends, learned to trust people in different organizations and do what's right for people. I know that will continue. I do plan on serving in the many various organizations that support children in our county, many nonprofits, and I do plan to participate in the Community Vital Sign still as a member of the Implementation Committee and a few other committees, because my heart is in San Bernardino County. I have a passion for this work, and it truly is an honor to be here and to have been able to work with so many wonderful people. I can't even name them all, but thank you so much for all that you do. I look forward to seeing what has to come in San Bernardino County for our future families and for our children. So thank you very much.
Thank you very much. And hopefully Ted didn't work you too hard there and make you force out at 34 years. You definitely deserve, after a very long career, a great retirement. Ted, do you want to come up and take a picture as well? We're going to turn over to our CEO for COVID Courage Department recognitions.
Thank you, Chairman. I'd like to invite Diana Alexander, Assistant Executive Officer, to join us. Today, we are going to be recognizing a couple of different functions. I want to highlight one of them because it's caused us, I think, a lot of opportunity to celebrate and to see the good work of staff. What is known as a SNF, a skilled nursing facilities, early on in the pandemic, there was quite a bit of concern for those who we would consider most vulnerable. And county staff, in working with public health and ARMC, really stepped up and came to an idea of having a task force that would be dedicated to responding and providing services to these areas. So with that, I'll hand over to Diana, who's just behind me, to give a little bit more of an introduction.
Good morning, Board of Supervisors, members of the public. Today is the last day that we will bring to you COVID Courage presentations in the form of the videos that we have been presenting to just highlight the courage that our staff have displayed during the COVID pandemic. We couldn't have planned it better. We did not plan it, but to end with featuring Arrowhead Regional Medical Center and to also feature our skilled nursing facilities is just amazing. We have 2 videos to present to you today. After those videos play back to back, we will bring up representatives from each of those groups to receive their COVID Courage pins and also to take pictures with the members of the board. And later they will be getting some wonderful gifts from our Human Resources Department. So we'll go ahead and start those videos and make a few comments afterwards.
That skilled nursing facilities would have some unique and particular challenges because of the type of patients that they care for. They commonly have comorbid conditions and are likely at increased risk. And then they're all in close proximity. So there's some high concern for rapid spread of COVID within those facilities. So we put together a multi-agency work group, task force, if you will, that we call the SO+S task force. And that stands for Skilled Nursing Facility Outreach and Support Task Force. And that was made up of our Emergency Operations Center, some of our PAs from the Arrowhead Regional Medical Center's Emergency Department, our department chairman, Dr. Rodney Borger, and members from our public health team, as well as some administrators from around the county who could help to guide us in the right direction. As we have learned more about the disease and the spread of the disease, we've been able to really focus our efforts in the skilled nursing facilities. And we have actually been able to reach out and visit all 55 licensed skilled nursing facilities in our county. And that was our initial goal, and it seemed like a very big goal to start with. But now that we've formed really strong relationships with the management teams in all of those facilities, we've helped to supplement their PPE, provide them with excellent infection prevention practices and management, as well as support their emotional needs. We've been able to actually expand that list and now reach out to many of the other long-term facilities in the county. So we've actually visited almost 200 facilities over the past several months and formed a network with them that they know who and how they can reach out to 24 hours a day if they need any particular type of support. And then kind of bringing it down to a human level is that these skilled nursing facility workers who pride themselves on going to work every day and taking care of their long-term care patients were rightfully scared through this, and that we've been able to go in and make a human connection with them and support them and educate them and teach them how they can not only be safe at work but not transmit the disease back to their homes when they return to their loved ones, has enabled them to keep coming to work every day and caring for their patients and completing the very important mission that they all set out to do well before coronavirus ever existed.
I'm Bill Gilbert, Hospital Director of Arrowhead Regional Medical Center. I'm coming to you this morning from the front lines at Arrowhead. Here we've seen thousands of COVID positive patients, and we've treated all of them with not only the best of care, but the highest regard and respect for their personal well-being.
These patients came in pretty sick. They had trouble breathing. They had very high fevers. Their vital signs were abnormal. So they really struggled to breathe. That was probably the biggest thing that we dealt with, fevers and breathing, trouble breathing for sure. We supported them with a ventilator to help them breathe. We supported them with medications to help their blood pressure and their vital signs stay stable. Supported them with medications that we were trying to figure out what would work against COVID. Seeing patients that recover and get better and patients that we were able to help. Patients that were really sick and got home, survived this thing that we're all going through. That's been the best thing is seeing stuff that we were doing actually help and get these patients better.
As we continue to go through this pandemic, I can't help but think about the courage that all of the team here at Arrowhead has exhibited, as well as the other partners in the county that we've worked with to combat this pandemic. I'd like to say a special word of thanks for the departments that have worked with us to create the SOS SNF Task Force, which is a group of Arrowhead employees, behavioral health, public health, as well as physician assistants that go into the field and try to help the skilled nursing facilities fight the pandemic, treat their patients, and keep a safe environment.
At the peak of the COVID-19 surge, Arrowhead Regional Medical Center had to pivot. We have successfully treated over 2,000 patients with COVID-19. Mortality has decreased. We've had many successful new treatments. We've established drive-through testing. We've increased our testing to include asymptomatic people as well. We've made lots of progress. Initiated hand washing and masking, and that has now started to take hold in our community. We've successfully flattened the curve. Now we need to go to the next step. We need to push the curve down. We need to increase testing of asymptomatic people to decrease the asymptomatic spread of this disease. We need to do this to help keep our families safe.
We've had a long road, and I know we're all tired, but truly, this has been an opportunity for all of us to show the talent that the employees and the team in San Bernardino County have, and how we can apply that to bringing this pandemic to an end and doing what is best for our county. I'm very proud of all the work that we've done and the team at Arrowhead.
And now to receive their pins and to take their pictures, we're going to start off with Dr. Borger, who is here representing the skilled nursing facilities. As you can see, he was on the video also, so he represents quite a bit. There's so much overlap when it comes to the team and collaboration that has happened that everybody could probably get up just about to help be a part of this. And next we have Nanette Buenaveras representing Arrowhead Regional Medical Center. And I shouldn't fail to mention that Bill Gilbert is also here, the director of Arrowhead Regional Medical Center. You might want to come down. Corwin, all of you guys probably could have come down on these.
Let's hear it for our healthcare workers this fight in the lines every single day. And thank you, Diane, for putting this together to highlight all the good work they do all the time on that.
And thank you also. We just want to say thanks to a board who would take the time in an important meeting like this to recognize staff accomplishments during the COVID pandemic. But we recognize you also for the partnership that you have created an environment for us to create. And it's just been amazing. Even though COVID is horrible, the teamwork that we've experienced has been incredible. And we're so grateful we had an opportunity to showcase the staff. Thank you.
Thank you. And it's funny because our staff, I guess we got the best staff in the world out here. They work so hard and work so well together, but they're not perfect. You see where we put the wall. This is a new design for the board chambers. And poor Jeff's going to see Dr. Borger because every time he wants to take a picture, he has to bend over one way or the other. He's going to have to go see, he gets some back issues later on. But no, they do a great job. Thank you all for doing that. before we get to the CEO, we've been doing this. We pull out, since it's probably one of the most important topics for our residents every board meeting, is the COVID update. So that's a discussion item that we generally bring up to the beginning and allow the CEO to give us a status where we are since the last board meeting we had, and kind of give our residents the chance to know what's going on. So we'll go ahead and do that one first.
Thank you, Chairman. We have a presentation that we'll go through fairly quickly. Before and if you can cue that up, that'd be great. And as we get started, I want to acknowledge that we have Corwin Porter, Director of Public Health, Bill Gilbert, as you just saw a few minutes ago, Arrowhead Regional Medical Center Director, and Daniel Munoz, the Office of Emergency Services Director, all here to help answer any questions that you may have. Okay, let's go ahead and go to first slide, please. Next slide, please. Wonderful. So in this update, we're going to talk about testing, the new state stay-at-home order, vaccine planning, protecting our most vulnerable residents, and stopping the spread. Next slide, please. Why get tested? It's critical to have an accurate representation of how many people have COVID-19 so health officials know the extent of the spread locally. Our team continues to work with many different functions such as the contact tracers, et cetera. Tests capture health conditions at a point in time. Let's see here, I think I'm a slide ahead of myself. Go to the next slide and we'll circle back here. Slide 3. All right. Slide 4. There we go. Tests capture health conditions at a point in time for higher frequency, and the quicker we can identify the issues, the quicker we can slow the spread. If we can show that we are testing large numbers of people while keeping the percentages who are testing down, it helps us get prepared to reopen when the time is right. Testing can assist with getting the county out of its purple tier. Let's go back to the next slide. This is a slide I want to call down Daniel Munoz. The reason I went ahead is I want him to talk a little bit about how much testing has the county done. I think we've made a lot of strides here, and I'll let Daniel cover this slide.
Can you folks hear me?
Yes.
Okay, thank you. Thank you, Leonard. Good morning, Mr. Chairman and Board of Supervisors. Daniel Munoz, Director for the county's Emergency Operations Center. Thank you for this opportunity to share what the team has been doing in regards to testing. As we see up here on the slide, the dates, and probably most folks in the world, started off a little bit slow when it came to testing, but the team has really rounded up, come together, and as a result, we tested over 1.2 million folks countywide. So I think that number alone is something that should definitely be celebrated because of the amount of energy and effort that the team put together to accomplish that. Additionally, the county has set up 10 stationary sites to provide testing to county residents, strategically located through all supervisorial districts in the county. We currently operate 2 testing locations per supervisorial district. Our capacity right now is peaking out at about 8,000 plus tests per day. Our appointments continue to be maximized. We are averaging currently about 8,000 appointments daily. In addition to our stationary sites, we also have the ability, we've built out what we call mobile testing teams. So these are folks that can go out into the community and bring testing to those folks that might not be able to travel to one of our testing sites. Currently, we're booked through the end of December. We have a mobile event that takes place just about every day, including on weekends. So that's another great opportunity to provide for our residents. And then we're super excited about a new product that this board has allowed us the opportunity to also bring to our residents. It's basically a grab and go self testing kit. And so there'll be more information on that. But that's something that we're really excited about because we think that will provide even greater access to testing for individuals that's difficult to get out to our testing sites. Leonard, I'll turn it back over to you, sir.
Yeah, we'd like the public to note that if they visit sbcovid19.com/testing sites / they can have all the resources through our website available to them to make appointments, etc. Let's go to slide 5. Daniel mentioned the grab and go testing sites, and this is again we want to thank the board for their commitment to expanding our testing opportunities and ability to get out into the community. Testing at your doorstep, grab and go kits to test where you live or work. Results are guaranteed in 48 hours. Return kits to the county via FedEx for processing. Allows for smaller testing footprint. We're currently available to large employers and city partners that are working with the county, and the goal is to continue to expand that out. We have the email address down below. If there are any large employers or cities that would like to partner with us, they can send an email to that address there, and we'd be happy to respond to them and start working with them.
Leonard, on these type of tests, I think we just had a presentation in our SNF facilities. What are we doing to test those seniors that may not be able to make it out? Are we using these type of kits? Are we bringing tests to them? And what's the schedule like for them?
It's a great question. I wonder if, Bill, are you able to join us? Thank you. Please join us at the dais. Appreciate it, Bill.
Good morning, board members, Mr. Chairman, new board members, Supervisor Baca, Supervisor Cook, welcome. It's a great team. Glad to have you on it. I'll just mention that the skilled nursing facilities have required testing and do PCR testing regularly. As well, that testing, which is publicly reported, is tracked by the Skilled Nursing Task Force so that if there is an outbreak, either with residents or with staff, we are able to go in, offer infection prevention, coaching, assist even with staffing. So the skilled nursing facilities are tested regularly. By the way, as of December 14th, all hospitals will be required to test all of their employees. We're still working through how that's going to work, but it is quite an undertaking for some of the larger hospitals, yet it will produce some excellent data for us to follow and track.
And I was going to ask follow up on probably later in the presenting on this, but what are, I guess, Michelle, the legalities of requiring the testing? Because we have talked about that we start testing county employees as well. I mean, it's one thing to have things voluntary, it's another thing to have a mandatory testing. And I really haven't remember much in the history of making something mandatory like that. And it goes as far as, I guess, as the vaccinations come out, since your personnel probably the first ones on that line. I know we do have something for getting a flu vaccination, but can we mandate COVID vaccination? So there's a lot of new areas here. Love to get the perspective from either one of you on that.
I can only offer a perspective, although I've not run this by council. Likely we'll be getting together on this in the near future. With the skilled nursing facilities, it has been mandated and it is working very nicely. Of course, the residents welcome this kind of testing to protect them. The employees as well have cooperated. I don't know if I can say 100%, but largely. So I think we can check on the legality, but this is a requirement coming out of the California Department of Public Health and, endorsed by the governor. So I think it's necessary to curve the trend. So thank you.
And I'm very supportive of it. I just, as we get into outer layers of the medical profession, into other, our staffs, different departments, or to the public, I just see at some point, I know from a lot of my residents, some really have issues with trusting the vaccination coming out and going forward. So I think we also need to do a lot of PR work as those start to be distributed, showing that the leaders in the medical profession, leaders in that they have throughout the community are taking it voluntarily and that they believe in it. I think that will go a long ways to get the residents to believe in it as well.
Yes, sir. And later in the presentation, we'll talk briefly about the fact that we are going to do a very strong education campaign throughout the county.
Bill, why don't you stay and join us here? We're going to go through the next slide fairly quick. Daniel covered most of the components of mobile testing and community impacts and state resources. On this slide, what I would like to say is a big thank you to all the staff. It's really been an interdisciplinary effort from many different departments across the county who have helped with the testing effort, have gone to the far reaches of our county, all over from rural to urban areas, working in parking lots, working after hours on weekends, and we really appreciate their effort that has allowed us to test over 1 million people between April and December. The next slide, and I'd like to call Corwin up and for Bill and Corwin to be available to answer any questions about the stay-at-home order. As we all know, California issued a stay-at-home order due to the rate of increase in the new cases. Because the stay-at-home order deals with the 15% ICU bed availability triggers, both Bill and Corwin are here to answer any questions. I'll allow Corwin to give a brief overview of what the new stay-at-home order highlights.
Thank you, and it's a pleasure to be with you, members of the board. So the new stay-at-home order, as most know by now, went into effect 11:59 Sunday evening, and that was due to our ICU capacity within the county dropping below 15%. We are one of 2 regional areas out of the 5 that moved into this realm of having this order in effect. And so both of those regions, ours and the San Joaquin Valley, went at the same time. There is an exit out of this if our ICU capacity at the end of the 3-week period is projected over a 4-week period to be at 15% or higher, then we can exit as soon as December 28th. Until then, the order is in effect for this current time period up through then. And there are a number of things that this order requires. There are some sectors that are required to close, some to be modified, and then the state to help answer the numerous questions that continue to come up from every sector on how this applies to them in the specifics. I've started to put questions and answers on the CaliforniaCovid19.com website. And so we encourage residents to go there and look up answers to their questions. We continue to ask the state additional questions for clarity. So that's an ongoing process. But one of the things that is unique about this particular order is that it did leave some things unchanged. So worship services are still allowed to open outdoors. Schools are still allowed to, that have approved waivers, are allowed to function and operate. And exercise is encouraged. There were some restrictions around retail, capping at 20%, and grocery stores at 35%. So there's quite a few details in there depending on what sector a person resides within or the questions they have that they can find answers to. But I'm happy to answer any additional questions that you have.
I have several for you, Corwin. I'm sorry. Anybody else, please feel free. We talked about the number of beds. This is on the 11 counties, Southern California counties put together, and number of ICU, percentage ICU beds. We talked briefly about this before, but what's the percentage of the ICU beds roughly for the region that's currently being occupied by COVID patients?
I don't have the exact bed number, but I have the percentage that applies to our county. So as of yesterday, it was 10.9. I'm not sure what time it is right now, but around noon, they're going to release the next set of data, which will put us at 10.1% as a region. Yesterday, the county was at 12.8%.
So 12.8% and 10% for the region is occupied by COVID patients at this point. So just doing basic math, that 90% are not COVID in the ICU beds?
No, sorry, my apologies on not making that really clear.
Oh,
So
it's how much
that's the
capacity
ICU
we have.
capacity that's remaining. That's the percent. It includes pretty much everything. The reason they there's another standard in there. It says if your ICU capacity has more than 30% COVID positive patients, then there's a little bit of reduction factor as you go above that. And so our county, I believe, is above, according to the state, that 30% currently. I don't have the exact number this morning, but we are
would you
above that
say
percent.
under 40% are COVID in our particular county, for example?
Yeah, I mean, if we use that number, right, then If we were at 40%, then our number would be reduced by 5%.
And I'm not trying to be argumentative, but I'm trying to get a picture for our residents to know that less than half of our ICU beds are currently being occupied by COVID patients. The other half, a majority, is by other type of patients. It could be the regular flu, it could be
Right.
elective surgeries, non-elective surgeries, wherever the case may be. And at least for my personal opinion, I feel it's a bad matrix to say how prepared your county is or your region is to deal with the uptick of COVID patients when the majority of your capacity that you're utilizing right now, which we want to utilize our medical capacity to keep our residents healthy on other means, is the one they're using the matrix on us as of last Friday. And then, if my understanding is correct, we have built in surge capacity through all our hospitals, as well as external sites that the county is using taxpayers for right now to prepare for even further need. We have a tent at Arrowhead. We have looked at different places throughout the county to host patients. And we have not, thankfully, had to call on those resources yet. But even though they're there, we cannot count those beds and those availability of spots, so to speak, toward the state's grading us if we're prepared for the COVID surge. Is that correct?
The state is only counting staffed beds. So yes, if those are unstaffed, which you had described, that would be the case.
But they're still requiring us to have those unstaffed beds, even though we can't staff them. So to me, it just seems like a dichotomy where we are going to force you to have all this extra room, which thankfully we haven't needed yet, but we can't count that extra room toward our preparedness for the onslaught of the COVID. And this is the part that drives me crazy with the governor, is he give us this criteria on a Friday and react to us on a weekend is saying we're going to shut down, 85% of the California's population with these new health orders, even though we've been following the rules of being prepared. I mean, they told us in the summer, but wait for flu season, COVID's going to go up. And sure enough, it has. And 3 weeks before Christmas, he wants me to enforce shutting down our businesses and tell our residents to stay home over the most, for some, the most magical month of the year as far as holidays and visiting. And yet you are, both Bill and your teams have been preparing for these type of events. Not that we want to see them to happen. And you've been doing an excellent job of reacting to those that happen. And we can't even count the numbers to their criteria. And so at least I'm frustrated, and I'm hoping that maybe Leonard can give us, or Michelle, when you go through, I'm sorry for hijacking your presentation so far, but it's you can always manipulate numbers. And when I found out that we can't even use our capacity that we built up toward these numbers, and now this new order goes into effect on a Sunday when they tell us on a Friday. And I know that, Bill, you have instructed your team to, when you get to a certain point, not to take voluntary surgeries and other things that we put off. Not that they're not important for some, but we have the ability to manipulate those numbers somewhat, even in the way to count those beds. And again, another way to count the beds is how many nurses we have or one nurse for every 2 beds. With the waiver, you get 1 nurse for every 3 beds. But that's an artificially number put in by the state as well. So the numbers can be manipulated, is what I'm saying. And it seems like it's manipulated always in our worst light versus the best light. And we are prepared to take care of our residents. And we've been there to help our regional partners, the counties, from day one when they sent folks out from Imperial to our hospitals and other places. We've been there to be helping hands for our neighboring counties as well. And yet we're not getting credit for that. I'm sorry for the commentary. And anybody else has anything to say? If not, we'll let Leonard complete his presentation. Sorry.
Thank you, Chairman. If we go to the next slide, please. So the county is diligently preparing for vaccination rollout. The strategic vaccination rollout plan is being finalized by staff. Vaccine storage and refrigeration is in place. The Pfizer COVID-19 vaccine is the first vaccine to be distributed, anticipated in mid-December. Mirena COVID-19 vaccine will closely follow. 4 phases. Initial vaccination phase will be focused on the frontline workers. And it's important to understand that it's the state's 4-phase approach that the county is following and how those vaccinations are rolled out. Larger community vaccination availability will follow in future phases, and we will be working with the team on messaging to community to build confidence in the efficacy, I said that word wrong, and safety of the vaccines. I don't know, Bill, if you have anything you'd like to add about the vaccination.
Only to say that it will soon be here, the first phase. We are working very collaboratively. This is another example for the board of your departments working together to get this vaccine out. Now, it will be the frontline healthcare workers that are first up, but we're hoping shortly thereafter, we're going to get additional vaccine that will be able to be rolled out incrementally to the most vulnerable, and then ultimately to our entire population.
Next slide, please.
And Bill, may I suggest that maybe when your staff, some of the, especially the leadership of your staff, actually gets a vaccination, that we put on YouTube or something like that. These are the medical professionals that look at this stuff every day. And I know that seeing polls and even talk to my residents, they're afraid of it. And we need to make sure that they're not afraid of this. This is going to help protect them and their family. And the more, not just written materials, but visual materials and people talking about it, and knowing that, you know, the entire medical staff is taking it, that shows a lot of confidence in it. So the more we can promote that going forward.
And the science is there. I don't know about you, Dr. Borger, but I'll be in the front of the line with you. And we'll move forward. We will work as well with David Wirt and Justine Rodriguez to get that out into the public.
I know that 4 former presidents have volunteered to be videotaped, you know, when they
Right.
get theirs as well. So I just want to make sure the public knows this has been well vetted, even though it's been accelerated.
Yes, sir.
Yeah, and the communications team that's working on the vaccination plan will also be working with all our city and towns and their PIOs to make sure that the information that we're putting out, that they have access to it and can help to disseminate that as well. We go to slide 9. So what do we do now until the vaccine? Really is stop the spread. And our encouragement is for folks to continue to get tested. It's critical to have an accurate representation of how many people have COVID-19 so the health officials know the extent of the spread in this region. Tests capture health conditions at a point in time. The higher the frequency, the quicker we can identify the issues and slow the spread. If we can show that we are testing large numbers of people while keeping the percentages who test positive down, the state will permit us to reopen our sectors. Last slide. We end with a reminder for folks to wash their hands, cover their face, maintain physical distancing, and if you're sick, to stay at home. That concludes our presentation. I want to thank the staff who helped work on this and have been doing lots of work over the weekend, as you mentioned, Chairman, with the pivoting from the state. We had a whole team this weekend working on how do we respond to that, and they have my sincere thanks for their dedication and hard hours. I'll turn back to you and see if there's any questions.
I'm sure. Can you just give us an update, maybe Michelle or Leonard? I know the previous board has authorized us to take some action against the state going forward to try to bring some of this local control to ours, and to remind our residents that this county so far has taken no more restrictive action than what the state has basically forced upon us. And but can you give us just a brief update on that?
We have not yet filed the litigation. We have been working with outside counsel on that, and we're hoping to be in a better position toward the end of this week. And we're still fleshing out the legal arguments because, as you can imagine, this is a pretty complex area.
But this is definitely a priority for all of us, and you are in your outside legal team, which I know we had to go get a couple different partners on this, are working on it full time, even over the weekend. I guess
Yes.
basically say that because I know I talked to them over the weekend. So we're working on it as fast as we can to get something that's hopefully be some relief to our residents here in San Bernardino County. Any other comments, Supervisor Rutherford?
Question, I don't know if it's for Leonard or Corwin, but I keep hearing, despite what the chairman just said about our enforcement in this county, that there are restaurants who have been fined up to $10,000 for disobeying the orders. Are you aware of any fines that have been issued in this county?
Thank you, Supervisor. No, we are not aware of any fines that have been issued in this county. Our approach is to educate and engage, and there are no fines that have been issued.
Supervisor Cook.
Yeah, I want to thank everyone for the briefs. It was very informative. I had a question about preventive medicine, preventive health. Obviously, as we get more data on this, there are certain contributing factors. One of which is smoking. And I know there's a lot of ads in TV about that are anti-smoking, but it certainly is in concert with, I think, informing the public that if you have certain bad health habits, it's going to probably increase your risk to, and I'm not a doctor, I'm not very smart and this and that, but the more data we have on that to reinforce that, particularly with our younger people or what have you, and older people, but the more data we have on that and avoid the narrow occasions of sin, if you will, if we could take a look at that. And I might add the chairman of the board in concert with that has suggested that all board members go on a trip to parachute into Antarctica as our contributions to making sure that we're fit and ready to face this threat. And thank you very much.
Took my winter warfare school a long time ago, sir. That was a long time ago. But Supervisor Baca.
Yeah, thank you, Chairman Hagman. I had a question back on the testing. I personally got to go through the testing. I actually knew I was going to be on this board of supervisors, so I went through. My wife actually set it up through the online and got tested through behavioral health on Pepper and Foothill, and I've seen the tremendous growth from April to now. So the great thing is you get your results within a day or two. You either get a text, you get an email. I think that's important for the public to know. And I think that's great that it's booked up to the end of the year. But here's my question is, here we are only December 8th, and we're booked up to the end of the month. My question, because I know that as you booked online, I mean, those appointments fill up rapidly. So my question is, what do we tell those that cannot get an appointment this month, at least with the county? And then the second question is, with the potential spike in cold and flu in January, are we going to offer the same amount of testing? Are we going to increase the testing? I just hate to turn people away that actually really want to get tested.
Supervisor Baca, thank you for the question. Sure, appreciate the opportunity. So the county has 10 stationary mobile, 10 stationary sites. In addition to that, we do operate mobile sites on a daily basis, including on weekends. One of the pieces of information that was on one of the slide deck that we didn't necessarily go into a lot of detail on is the team has also been working with the state to bring in additional testing resources through a company named OptumServe. And then we're also currently in communication with another private vendor to bring in additional testing resources. So we're constantly trying to increase our capacity through all of the available resources that we have. I think one of the potential solutions to one of the issues that you raised is that by utilizing the resource that the board is considering today is with those picture test kits. That is another tool in the tool bag that will give us additional capacity to increase testing for our residents. But certainly appreciate the comments. I think across the nation, across Southern California, I think that capacity will continue to be one of those key issues that most folks are going to have to grapple with. And I think from our county standpoint, for what I've had an opportunity to experience, is that we're not leaving any stone unturned. If there's a resource out there that we have an opportunity to get our hands on, we're fighting hard to do that, to make sure that we don't have to turn away anyone. And I think one of the other things I just want to highlight, I think Leonard touched on this, is that our staff do a tremendous job in terms of if anybody shows up at our sites, it's it's very difficult for us to have to turn folks away because we understand that, for some individuals, it could be the difference between being able to go back to work, seeing a loved one, travel. So there's all these different dynamics that come into play, and we're certainly very sensitive of that. So we absolutely do everything that we can so that we don't have to turn away anyone. However, the reality is that at times, we do have to do that, but we try to minimize that to the greatest extent possible.
No, and I
Thank you.
appreciate the comments in question, but just to give you an example, say someone logs on and they can't get it because it's booked. So will they know that they can go to alternative site? Is there a way that they can know either by looking at the website or any other option? So they know that potentially I could go to this mobile site on this day.
Yes, I think our website covers a lot of that information. It provides people with both the testing opportunities that the county operates, also the testing opportunities that our state resources provide. Those resources provided by our partners at Arrowhead Regional Medical Center, and then also private partnerships. That includes the CVS's, the Rite Aids of the world that also provide testing. We have all that in a basically a one-stop shop through our website. So if folks visit our website, then there's a plethora of information on there that folks can access and see all of the different testing opportunities that are available in the county, not necessarily operated by the county, but that are available to them so they can take advantage of those.
I do appreciate it. I think last week, the mobile testing was in the city of Rialto. So I appreciate the partnership with our city clerk, and I believe they gave flu shots and COVID testing. So I appreciate the update. Thank you for the information. Thank
And
you.
Supervisor, what we'll do is we'll make sure that on the weekly updates that go out on COVID news, if we start seeing that we're at capacity with the scheduled appointments, we'll highlight the other testing opportunities and direct people to the website so that it's clear what other options they may have. So people don't get the impression that there's no opportunity for them to be tested if they need to be tested.
We've seen, I know we did at the very beginning of this when we had very limited number of test kits and such. But since we've been kind of the last month or so, we've seen people being turned away at this point. And granted that we are doing 8,000 tests plus a day, and we're not the only people in town. There's the private insurance carriers, the private doctor's offices, like you said, the CVS, Walgreens, employers have their own arrangements in some health clinics to get people tested. So I haven't heard a lot of people being turned away. A lot of people just show up, they'll take you. But are we seeing that? Have we seen the strain on our resources at this point as far as getting the equipment or getting the test kits out?
I'll ask Daniel. Hey, there you are. Yeah, I need a mirror right here to see who's behind me, rearview mirror. It's a very fluid situation. Just a few weeks ago, we were talking about how we were at 40% testing capacity, meaning that we were only testing 40% of what we had available. And now, of course, because the spread has increased, the good work that the team has put into place, we are testing at higher numbers. I'll let Daniel speak to what that impact is and what the reality is on our resources.
Thank you. So the short answer, unfortunately, is yes. We've had to turn some folks away, unfortunately, just because we've exceeded perhaps capacity for the day. But again, that's one of the things that we're constantly looking at is how can we increase the capacity, provide folks with different options to get that test, whether it's turning them away, but perhaps utilizing these picture kits as an option, perhaps registering there for an appointment the next day, just offering whatever resources we can to provide them access to testing. It's not always easy. Like Leonard mentioned, it's a fluid situation that pretty much has been changing by the day. But we're hopeful that, as we continue to work through this issue, that, we'll have the capacity, hopefully, to test anyone that wants to get tested. That's the goal.
Is our testing kit capacity? Is that our personnel capacity? Is that our third party contract capacity, reagents? What's limiting our factors right now?
I think honestly, operationally, one of the challenges that we have is that, there's many, it's not on the supply side necessarily, is, we continue to look at our operational hours to see if we can extend those. However, there's logistical challenges that come with that. One of the things about getting tested. If we look at it from a continuum standpoint, it's not only do we want to get folks tested, then next to that is we want to make sure that we provide quick results. So one of the things that limits us is how late we can operate, because we have to get those specimens back to the laboratories to start to begin the processing cycle. So if we stay open later, then there's a delay in that. So it's just basically trying to, find that sweet spot of trying to provide the most testing and still try to be expeditious in terms of getting those results back.
Okay, well, I'm hoping that if it continues to be an issue, you come back to the board for some policy direction, because if someone's taking the time to go out of work or away from their family to go get tested, the last thing they want to hear is that we have no room for you. And that may be the one chance they have to go do it. And that's what we need to do what we can. If we have the supplies, then we got to work everything else out. So hopefully if it can, please bring it to our attention, it continues to be an issue.
Yeah, Chairman, we'll bring something back for the board's consideration as what staff's recommendations are to continue to increase our testing capacity.
And the hours too. We've been talking about that for a while as well, because a lot of people can't leave work to go get tested. Supervisor Rao?
Quick question. How many tens of millions of dollars are we spending on testing each month on average right now?
So the staff calculated as we go forward, the testing activity will range anywhere from 12 to 20 million per month, depending on the level of the amount of folks that we have to test. Obviously, in the current environment, that's what we're testing our numbers. That's more of a $20 million number per month based on all the expenditures related to testing.
And we're still shut down. And that is CARES Act funding reimbursable that will go away at the end of this year.
Correct.
And then we will be paying out of general fund to sustain that same level of funding.
Yes, and obviously we'll bring that back for board direction. But if we continue at the testing levels that we're at and there's no extension or new stimulus, it would have to come from the county's general fund.
Thank you.
Any other questions? We do have some requests to speak from the public. First is Philip Figgis. And after that, it's going to be Eliza Valentino. Philip, right there? Yeah.
Good morning. My name's Philip Fivges. I've been here a couple times. I'd like to welcome the new board members, and we pray that they would bring the same disposition, desires, and skills needed to address the daily living conditions of this large county and its population as those still present and those that have left. Today, we returned to ask the board, and we've been listening to some of the things that you've been talking about, and these are considerate of what I'm going to talk about, with great concern and interest as to the extent of their efforts and success in pursuing legal actions against the governor and his totalitarian leadership against the common and working class people of this state that support the Constitution of the United States and its original intent and mission to provide government leadership and representation for the people and by the people to pursue life, liberty, and the pursuit of happiness. In other words, to actively engage in the purposeful challenge of surviving and thriving in this sin-filled and perishing world. Thus, we encourage you all to actively engage in the legal needs and processes required to stop totalitarian government and its dictates coming out of Sacramento and its evil desires to destroy the law set forth in the United States Constitution and the First Amendment that grant all of us certain protected rights, especially those to speak out, like we're doing right now, and against government that utilize power to subvert the laws and institute illegal protocols restricting the local and common people, and especially those that allow assembly, whether public or private, and for various daily survival needs, including socialization, that should not be determined by discriminatory means and deemed non-essential. We support the board's position of having local control of the continuing conditions that involve the Wuhan virus and desire grassroots representation locally, entailing businesses, churches, schools, and the like that represent a wide array of daily living within the county, all being considered essential without discrimination and legal pursuant to the laws of the land, with nobody or no entity standing above others and outside of the law. That being said, has the board considered contacting other counties or individuals involved with those counties that have had success in legal processes against the governor, such as Kevin Kiley? If not, we suggest that you do so. He is a well-schooled Harvard graduate and vying for the common good of the people based on relevant and supportable criteria for solutions. He has been an example of what we as citizens are looking for in our leadership. He has a contact website.
That's time.
He has good information.
Thank you for your comments. Liza Valentino, and after that, Shannon Gayton. I'm sorry, you have to go up there, ma'am. Thank you. Thank you.
Good morning, Chairman Hagman and Board of Supervisors. I had prepared a very different statement. However, after hearing your remarks about the progress of our county and the preparedness that you have made with beds and additional spaces, I applaud your preparation in this area. I have had to rewrite my remarks to include my gratitude to you for all the actions that you have taken to prepare us and to also stand against our governor and his actions. I also acknowledge Supervisor Cook's remarks about the benefits of healthy habits. I also believe that it is important that we empower individuals to be able to mitigate their own risk to COVID through healthy habits. But this message has been completely lost behind the public messages that seem to only mention sanitization, social distancing, and vaccination. I believe we would see much progress in fighting COVID if we could educate clearly about the healthful habits that we should all engage in on a daily basis. Also, we as citizens need you to take a strong stand against our tyrannical governor. I would urge you to take whatever action is necessary to gain local control, and I appreciate hearing that there is litigation in process for that. In closing, I would like you to consider the words of C.S. Lewis, who was asked about whether or not the existence of nuclear weapons should instill fear and panic in the peoples of the world. He said, "Do not let us begin by exaggerating the novelty of our situation. Believe me, you and all whom you love were already sentenced to death before the atomic bomb was invented. And quite a high percentage of us were going to die in unpleasant ways. It is perfectly ridiculous to go about whimpering and drawing long faces because the scientists have added one more chance of painful and premature death to a world which was already bristled with such chances, and in which death itself was not a chance at all, but a certainty." I would invite you to remember that a healthy community is so much more than an absence of a virus. Thank you.
Thank you for your comments. Shannon Gayton, and then Ron Sellers.
Good morning. It's Sharon Gaiton,
I'm sure.
and I represent the Mexico Cafe in the city of San Bernardino. I'm here on behalf of almost all the businesses in San Bernardino City. When this pandemic started, we followed every single rule. We even got COVID certified. We had to invest in, for the summer, over $1,000 worth of fans, easy ups, of course, the sanitation. We had to invest in plexiglass. We invested quite a bit, and that was when we were at so much capacity. Then they took that away, and they said outdoor dining only. Again, we had to invest in all these things, and pre-COVID, we had 60 employees, over 60 employees. Now, with today's shutdown, we're going to go down to 15 to 20. our business, our servers, most of them are single moms, and they rely upon their tips to be able to either pay their bills. And this year, they're going to have to make choices whether to pay their bills, pay their rent, or buy their children presents. Now, we don't make our servers, we don't make any of our staff, we don't tell them they have to work. They choose to work. And at this point, like I said, they're hoping that we'll take a stand and do something different against this lockdown. But again, because we're always threatened with fines, they'll take our liquor license away. We're being treated like criminals, basically. The businesses are being treated like criminals. And of course, I'm not going to go into all the details, but we all know the hypocrisy of Governor Newsom and whoever went out to the French Laundry, now Mayor Garcetti. It's okay for them to do this. And the medical board that was with him at his fancy French Laundry restaurant. I don't see them shut down. And there's somebody here told me they're still taking reservations. So why it is that the elite seem to garner the favor and all of us hardworking little businesses are disregarded. My personal opinion is we, the people, are not children. We can take personal responsibility. If I feel my father's 87 years old, would I take him out? Probably not, because he's diabetic and has other health issues. That's called personal responsibility. I'm sick and tired of being treated like a child and have fingers wagged at us when everyone else can do whatever they darn well please and continue to get a paycheck and their health insurance and whatnot. I implore that when you sit there and watch your children or grandchildren open gifts, think of those that don't have gifts to open them. And that's my employees. Our family, as a family-run business, decided not to forego paychecks. And that's still not going to be enough.
That's time.
So let me just say one more thing. I also want to know why there's picking and choosing. Why is it the casino is considered essential, a strip club is considered essential, but we're not?
Thank you for your comments. Mr. Ron Sellers?
She certainly had that right. I'd like to know how many entrepreneurs have lost their jobs and how many government employees have lost their jobs. Where do you think the money comes from if it's not from taxes? I said here some time ago that there's government employees do not pay taxes. What I was trying to say, because not always time comes up, is that they get the money from higher paid taxes, from taxes which are higher paid to them, I should say, and then they have to return some of it back in form of taxes. Well, that's just a refund. That's not really paying taxes out of their own work. They get more money than other people do. I'd like to also know about hospitals. I understand that hospitals get extra money if their patients die of COVID-19. How much? I don't know if the facts on this, but I've been told it's $28,000 approximately. Is that why we hear in the news, different places, that some people have died of COVID-19 when really they died of something else that they're already there for? Heart problems or who knows what. So where does the money come from? It comes from the hardworking people who pay taxes and generate tax income. And who do we have? We have EDDs trying to get more and more money for them so they can pay off these taxes. Where do you, employed by tax money, where do you get your money from? So if people can't do their own business, your money goes down. Should not your pay goes down? And how about retirement pensions? Why do supervisors get paid 90% of what the money they make when they're a supervisor? Is that correct? It's not right. I'm not sure if that's not really right. Somebody figure that out. Make sure that's if I'm right in what I'm saying there, please. And why is money is always chased down by the government? Governor Newsom, why does he have the authority to say what he has the way he says it? He doesn't make laws. he can relegate some things, I guess. He can do some things. He's in an important position, but I think he ought to be recalled without a pension. And matter of fact, I think every elected official should not have a pension after they finish their job. We have new official coming into the county here pretty soon as supervisor, as congressman. I hope he does a good job of being supervisor. I have no problem against the individual supervisors here personally. I think we have some great people here, but I think they're overpaid. I think the retirement is definitely way over bounds. And why do some people? I know somebody. She has a pension because she was in. I'm not sure it was the police or fire department of 110% because that's where her position was. Why? Why get a pension
That's
even more than you
time.
have?
Thank you for your comments. We're going to move over to the high desert and talk to Melissa Witzel. Morning, Melissa.
Hi, good morning. My name is Melissa Wetzel. I live in Apple Valley. First and foremost, I would like to introduce myself to my new district supervisor in the first district, Supervisor Cook. I would like you to know that I intend to develop a working relationship with you in hopes of restoring the freedoms of your constituents, specifically as it pertains to COVID-19 and in anywhere else needed. I sincerely hope you'll reciprocate in that effort. The same goes for all the supervisors and all other relevant representatives. Supervisor Cook, I have been speaking to the board since August 11th, 2020, and that's my birthday in case you wanted to take note of that. But anyway, I intend to continue speaking here and to band with others until there has been an adequate course correct to the COVID-19 response in our county. While I'm extremely appreciative of the upcoming litigation in the works against Governor Newsom, the compliance on the county's part is still baseless. For example, according to current data as of yesterday, December 7th, 2020, case fatality rates have decreased pretty substantially since at least October. And that's whether you're looking at the county level, state level, nationwide, or worldwide. The case fatality rate in our county as of yesterday was 1.1%. Yet we remain in compliance with the governor's guidelines. And of course, we can only go by the numbers we are provided, despite the many doubts that cases and deaths are accurately accounted for. How many of the COVID-19 deaths were actually caused by COVID-19 versus those who happen to have a positive PCR test at the time of death. Moving on, I would like to bring up some thoughts regarding the Newsom lawsuit and other potential litigation. I am curious where we stand with that right now. But first, I would like to suggest considering also a lawsuit against the California Department of Public Health. It seems their role is just as significant as the governor's in terms of all the baseless mandates pertaining to COVID-19. And as I've mentioned before, the PCR testing should be used in any litigation because it is being used as the metric for cases and therefore the metric for mandates. The tests need to be investigated. As far as San Bernardino County Department of Public Health, it might be time for more demands to be put on them in terms of knowledge of PCR testing. I had a conversation a little over 2 weeks back with our own public health director, Corwin Porter. At the time, he did not know anything offhand about the cycle thresholds being used in the labs and hospitals throughout the county, which is, that should be public information. I will be sure to provide pertinent information regarding why PCR testing is questionable to the new supervisors and all other information which I have sent to the previous.
Thank you, Melissa. We have one more left out here. We're going to move to Christy Sepulveda.
Up until this last week when Governor Newsom and CDPH moved the goalpost to now tying opening up a region to ICU capacity and occupancy, the metric used was COVID cases, which translated into PCR testing. Over the last several months, I have come before the board and presented information on PCR testing and also submitted information to your emails. Both myself and Stand Up San Bernardino County continue to highly encourage you to consider PCR test as grounds for your lawsuit against the governor. I will send this information with links to your emails again today as well. I come before you to share the latest information. Before I share, however, I must reiterate my plea that the county determines the following: CT cycle standard, program false positive rates, number of retests in its daily CITRIPS cases. A very recent study came out on December 3rd, 2020, titled Viral Cultures for COVID-19 Infectious Potential Assessment of Systematic Review. In their conclusion, they found complete live viruses are necessary for transmission, not the fragments identified by PCR. Prospective routine testing of reference and culture specimens and their relationship to symptoms, signs, and patient cofactors should be used to define the reliability of PCR for assessing infectious potential. Those with high cycle threshold are unlikely to have infectious potential. Also, on December 3rd, 2020, the state of Florida is now requiring cycle threshold values and their reference ranges, as applicable, must be reported by laboratories to FDOH via electronic laboratory reporting or by fax immediately. In late November, an appeals court in Portugal has ruled that the PCR process is not a reliable test for SARS-CoV-2, and therefore any enforced quarantine based on those test results is unlawful. Further, the ruling suggested that any forced quarantine applied to healthy people could be a violation of their fundamental right to liberty. Most importantly, the judges ruled that a single positive PCR test cannot be used as an effective diagnosis of infection. Further, the ruling goes on to conclude that based on the science they read, any PCR test using over 25 cycles is totally unreliable. Governments and private labs have been very tight-lipped about the exact numbers of cycles they run when PCR testing, but it is known to be as high as sometimes as 45. And you can find the original link, and I'm going to give you the link to that in English and Portuguese. In 2007, the New York Times wrote an article titled "Faith in Quick Tests Leads to Epidemic." That wasn't. It's a story of a real-life situation that occurred when the assumption was of an outbreak of pertussis. They relied on PCR tests, and 8 months later, they learned there was no pertussis epidemic. The New York Times concludes by stating, Dr. Kathy Petty, an infectious disease specialist at the University of Utah, the story had one clear lesson. The big message is that every lab is vulnerable to having false positives. No single test result is absolute, and that it is even more important with a test based on PCR. It has been a travesty for our county, for the state, for our country, for our world that we did not learn this lesson from 2007. Thank you.
Thank you. Okay, that's all we have on the that's receive and file item that 58 or 56. I'm sorry. We're going to go to regular agenda. We're going to ask the clerk of the board, is there any changes or updates on the agenda?
Thank you, Mr. Chairman. Following are the proposed changes to today's agenda. Item number 9 has been revised to add 2 recommendations that read as follows. Delegate authority to the Hospital Chief Medical Information Officer and Hospital Privacy and Security Officer to execute the confidentiality and security compliance statement and any subsequent amendments to the statement subject to review by County Council. Direct the Hospital Chief Medical Information Officer and Hospital Privacy and Security Officer to transmit copies of the statement and any subsequent amendments to the clerk of the board within 30 days of execution. Item 15 is being taken off calendar. Item 40 is revised to add a recommendation that reads as follows. Find that Barclay Andros' failure to insert the 10% base bid amount on P2 of its bid proposal was an immaterial error, given that in this section, Barclay Andros referenced the required original bid bond as attached and provided the same as part of its bid package prior to the time of bid opening, and it is in the county's best interest to waive the immaterial error. Item number 57 on the discussion calendar is being continued to December 15, 2020, when it comes up for discussion. Those are all of the changes that I have today. Thank you, Mr. Chairman.
Thank you. Does anybody like to pull off anything from the consent item for comment or separate debate? Seeing none, I am going to just pull number 25 just for a quick comment on that, but we'll entertain a motion on the remaining items of consent between 2 and 55.
So moved.
Second.
We got a motion and second. Just real briefly before I take public comment on consent items, if there is any, just want to point out on item number 25, we're changing the name, Information Service Department, ISD, to the Department of Innovation Technology. I wanted to see if Diane or Leonard can speak to that, and kind of exciting. I like it because it actually kind of has a different vision of what IT and those technological staffers are going to be doing here in the future. So,
No, it is an exciting
and Diane is right behind you. Just in case.
change. Yeah,
I need to
can
get you that
I can
rearview
see her
mirror.
on the glare there.
Okay, there you go.
So thank you, Diane Alexander, our Assistant Executive Officer. What I will say is this is in the same spirit of Innovate 2020, which was obviously overshadowed by the pandemic, but that we look to get back to as things resume in the future to a normal cadence. I'll let Diana talk a little bit about some of the ideas behind why the name change. Diana.
Good morning. Thank you so much. I'm here representing the Department of, as currently known as Information Services Department, and we are asking or recommending to the board that you change their name to the Department of Innovation and Technology. The department has been around for quite some time, but it provides comprehensive IT support and infrastructure services. And not only that, but when you think about the fact that ISD handles support, information, innovation, technology, et cetera, for one of the largest, if not the largest, agencies in the largest county geographically in the United States of America, it begins to make a broader picture when it comes to how we view the work that they do. The department has changed tremendously over the years, progressing from mainframe technological support now to mobile device support, high-speed communication, cloud-based services, associated infrastructure, and so much more. The name Information Services just does not represent anymore what the department has become. And so that's why we're excited to recommend that they change to the Department of Innovation and Technology, because that's actually who they are. And it also represents not only who they've become, but their commitment to innovation and technology in the future. There's so much more I could say, but it's there for you to view.
And I want to make sure that we don't get in trouble with Nike, because the acronym is Do It now.
I know.
So
I wanted to say that so bad.
DOIT. So, but no, we're excited for the changes you look forward. We have trying to bring on technology to governments in a bigger way than probably ever before in the history of the county, and we're seeing that. And I think that goes to the tribute, the awards that our departments get on an annual basis on the National Association of Counties. I think we've been #1 for 5 years in a row, and this 40, 50 awards every year. And just the innovation part of it, it's the exciting part of it. But that's all the comments I have, unless anybody else. Do we have any requests to speak on any items?
There are no requests to speak.
Okay, so we have a motion and second on consent agenda. All those in favor? Aye. Any opposed? Nope. Seeing, we'll move on to this public request to speak. Thank you. The first one we up is Jane Hunt Rubel.
Good morning, board members, and welcome the two new supervisors, Paul Cook and Joe Baca Jr. I'm in your 5th district. You probably know me from the Rialto City Council. Anyway, I'm going to save what I was going to talk about until the next meeting, because they moved the item 57 to next, which is good for me because it gives me more time to prepare for it. But anyway, I'd like to say something about, I finally haven't read most all of the general plan update. And, but I was interested, and I'm hoping that the new people on the board, and the board as a total, will start implementing, instead of passing every project that comes on board, especially this year, it seems like they just pass it before the planning commission and before you guys. It seems like they just approve everything without really public's input. And it seems like we're being dismissed by it. And I just want to make sure that you guys really listen to your constituents and like on the really listen to them and actually implement things like the county general plan update and our community plans, which were changed, which I'm kind of disappointed in, because it seemed like you weren't really listening to the constituents on something that's vitally important to our communities. And then not being notified about certain things either, like the Vulcan project, mining project. So I just would like to reinstate that I'm hoping the county will be more proactive on presenting. I was on the environment element group, and I'm wondering what's going on with that. For years, since the 90s, I've been asking the county to include that environmental protection for the whole countywide, especially the valley area, and have a living like county habitat and conservation and preservation, which I think the county is finally starting 3 years ago with that environmental element group. But I wanted to go forward because I just came across from 1998 when Jerry Eves, they were starting to have a conservation plan back then. But then Jerry Eves backed off from it because after 3 years into it, and I guess the board agreed with him, it went nowhere because he didn't like the endangered, the kangaroo rat being, on the endangered species list. So I just want to make sure this time, because habitats, especially in the valley area, need to
Thank you, Ms.
be
for your
protected. Thank
comments.
you.
We're going to move on to Armando Compion and then Rasham Bartley. Armando.
Good morning. Thank you, Chairman Hagman, and good morning to the members of the board. My name is Armando Compion. My wife and I own and operate a restaurant, La Casita Cafe, in the city of Hesperia. We're just completing 37 years serving the city. We currently employ 34 employees, many of who have worked for us for more than 20 years. So I'm here to speak on behalf of the businesses in the high desert and our employees as well. We all know that this governor is a hypocrite. He's adopted a do as I say, not as I do attitude. And that's impacted all of us much more than we've imagined. 9 months ago in March, we went ahead and followed the mandate at the time, the order. We shut down our business and did takeout only. What we thought might be 2, 3, 4 weeks turned out to be 3 months. Ultimately, we were able to reopen with restrictive dining in. That lasted 3 weeks. We then turned to outdoor dining only in the dead heat of the summer, 106, 110 degree temperatures. Yet our customers were able to accommodate them. We had to invest quite a bit of money at that time to put canopies out and in fans. And we've also had to invest a lot of money in indoor dining, where we added $1,000 worth of plexiglass screening, sanitation centers, and things of that nature. So we have complied with everything and currently are now faced with this new order to shut down again. We're going backwards. We're going back to March. You would think over the last 9 months, we've learned a lot, and we have, how to deal with this virus. But we've gone backwards, and this is unacceptable. Besides all the investments we've made, our main priority has been to protect the health and safety of our customers and our employees. And to date, I am not familiar with any science-based evidence that supports and shows that outdoor dining leads to increase in the spreading of the COVID virus. We want to urge the board to continue to support businesses throughout the county. to come against the governor and to establish reasonable, practical guidelines that we can follow and continue to operate our business safely. In closing, I just want to wish the board a Merry Christmas and Happy New Year. Thank you.
Thank you for your comments, sir. Rashim Bartley, and then Matt Thomas.
Hello, brothers and sisters. San Bernardino County of Board Supervisor. I'm here for kids suffering from the CFS department. They always come in my home July since 2014 until yesterday, in and out in my house. And my son was suffering. And they not follow the doctor's recommendation. The kids need it. And they don't follow, to go to the school. If the kids need a medical assistant, ever they provide it and they close the case. If need a healer in the visitation Fontana office. So my son get a asthma attack, he need a healer or medical assistant. They never provided. They drag like animals and cut my visitation and not treating like he as a human. They're violating the human right for him to get a specialist doctor to see identify his problems so they can be followed by the doctor. They block it. If somebody call 211 or any judge say, the kid is a risk, or the doctor or therapist saying the kid is a risk, they never care about that one. They're treating as like animals. And they're just doing the discrimination against the parents. And if we need a visitation and they cut the visitation for the parents. And also I sent a letter like last year to all the board of supervisors, the members. Please review my letters. You can review my case and what's going on with the kids and what's the parents go through with the children family service. Thank you.
Thank you for your comments. We're going to move on to Matt Thomas and then Kelly Good.
Good morning. I had prepared a couple of things as well, and after hearing the changes and the updates regarding the shutdown, have different thoughts. The first thing that I want to just ask is, who decided that Target's, Home Depot's, Lowe's, Costco's were safer than small businesses? I go to those stores on a regular basis, every day. They're not struggling. They're not. Nobody's talking about the fact that small businesses make up 85% of the economy in this country. I'm not considered vulnerable under guidelines, and I'm not essential. So what am I? What are my children? As a small business owner in California, I've always pursued the idea of being an entrepreneur. And I graduated around the time of the 2008 recession. Decided I got to work for myself, got to make my own decisions. Did that. My wife and I opened up a business. We started it last year. The plan was to be open in March. Couldn't have planned worse on our end. Here we are 9 months in, and we're doing the best we can. And 3 weeks before Christmas, we're told that small businesses in our little community are told to shut down. And my question is, if I'm not essential and I'm not considered vulnerable, where are my politicians who are supposed to represent me? Gavin Newsom has not represented me. He's not once spoken for my age bracket, the small business owners. He's done nothing to represent my children, my family, or my friends who have shut their doors and will never open them again as small business owners in my community. I'm truly asking anybody to answer that question of who represents me if I'm not vulnerable and I'm not essential. Big businesses are not struggling. They're having their best years ever. That's proven fact. Amazon, Costco, Home Depot, and Lowe's touting themselves as phenomenal record years during a pandemic. Might I add, a pandemic so deadly you have to have a freaking test to know if you have it. I haven't been tested. I haven't had it yet. How do I know that? I feel freaking great. Call me asymptomatic if you want. I'm just trying to figure out at what point do my public officials, my public servants who I choose to elect, and I've campaigned for some of you guys, at what point do you start representing me? I'm not vulnerable. I'm not over the age bracket. I'm not essential as a business owner. What am I? And when do I get to have the feeling that I'm being represented? Because I'll tell you one thing, I love my grandparents. I'm concerned about the elderly. But with all due respect, they've had their opportunity to live their lives. I don't mean that harshly. What I'm saying is I get one chance to be a business owner. I get one chance to be a parent, to coach my kids' soccer, to go to the Christmas programs. I don't get that. I don't get that. I get one chance at living my life. We all do. And I don't get that.
That's time.
I'm sincerely asking that I am being represented.
I said, thank you, Mr. Thomas. We'll move on to Kelly Good. At the Kelly is Nancy Richardson. Good morning.
Good
for another
morning.
9 minutes.
I've been a resident of Chino Hills for 27 years. I love this community. My first time addressing the Board of Supervisors, and I think it's important. I'm here to urge you to not comply with our governor's unconstitutional mandate and guidelines. Guidelines are not laws. Unconstitutional mandates are not laws. I don't deny that COVID is real, and for some, it is very, very deadly. The public trust has been fractured due to the inconsistent up and down guidelines and data that were given. I have numerous clients that tested positive for COVID-19 and never took a test. The response that our governor and other officials have to COVID-19 is overblown and not linked to science. It's been completely politicized. Did you hear that last week an 11-year-old shot himself while on a Zoom class, dead? The elderly are dying alone, and business owners are losing their businesses, all for a virus, for someone like me, 54 years of age, has a 99.5% survival rate. Johns Hopkins came out with a study that has been squashed, but believe it or not, the United States, as of today, has had fewer deaths than 2019. Fewer deaths, you heard that right. And I've been told that the hospitals have the same occupancy as they did this time last year. Same occupancy. I'm no epidemiologist, I'm no pathologist, but Roger Hodgkinson is. Top pathologist Roger Hodgkinson told Canadian government officials in Alberta during a phone conference that the coronavirus pandemic is the greatest hoax ever perpetuated on an unsuspecting public. Hodgkinson, who is the CEO of a biotech company that makes the COVID tests, said there is utterly unfounded public hysteria driven by the media and politicians. We are seeing politics playing medicine, and that's a very dangerous game. Positive test results do not mean a clinical infection, he says. All testing should stop because the false numbers they
That's
produce
time.
are driving public hysteria. Thank you for your time.
Thank you, Kelly. Nancy Richardson, then Philip Figgis.
Hello, and I welcome the new members of the board. You're going to get to know me probably. Last time you told us that you have not requested the county public health office to cite small businesses, and that you are also aware that our mountain businesses held a unique set of circumstances. I have proof that they are leaving these notices that show that they're punishable for a $1,000 fine or 90 days in jail. Okay, so it is correct that I personally have been to 3 restaurants where these were left. What was their crime? Trying to make a living. One business tried to stay for takeout only, and they had to close. They won't survive another lockdown. Another business is barely clinging to life, and the same day they received a notice from the health department, their son, the manager, was airlifted with brain trauma and has residual effects. A third business has also been cited. What were their crimes? Choice to patrons. They may sit inside during 15-degree weather or outside, even for takeout only. Everybody's choosing, of course, to stay inside. We have a different set of circumstances up there. We need clarification. Our sheriff won't enforce, but if he hands it off to the health department, businesses still suffer. We need to know who is authorizing these people to cite. By the way, Newsom's Winery is still completely open, booked through Christmas, inside. Does that not tell you something when they went to the French Laundry that the medical officer was with him? That none of them were wearing masks and there were 22 people. They were not afraid of the virus. Suicides are up 800%. Enough. This is a total scamdemic. You guys are getting a lot of money for continuing on with this charade, but you'll make a lot more money if you just let people open. People are on their last breath trying to keep their businesses afloat. There's no flu this year. I gave you all a copy of the San Diego flu season so far, because that's the only one I can find. I can never find information for our county. I can find Melissa Melendez's Riverside County, where she tells how many beds are available, how many are COVID, whatever. I've been asking Corwin 4 times in a row now to please give us that data. And again, you asked him this morning what that data was, and he can't tell you. I demand that Corwin resign or he gets fired.
That's
I'm sorry.
time.
I'm not even
Thank you for your
close.
comments. Philip
I'm not.
Figgis.
Tell FU to Newsom and just open up.
And after Philip is Gina Mong.
Well, again, I wanted to bring something that I had written down already for you, but what I've heard today is several business owners today that have described their diligence in maintaining the businesses with upgrades and adaptive procedures, equipment, training for their employees. All of that kind of stuff has gone into it, only to be shut down. There's been no stoppage. But even the procedures that we have, it doesn't make any sense anymore. Why would you come up with something that stops people from surviving? The last couple times we met, I spoke to you and I've told you of instances that go back hundreds of years to Martin Luther when he had to stand with the Black Plague killing everybody off. You should look into the numbers of people that died in that instance. And this man was persecuted at the same time. They wanted to kill him because of what he said to the Pope. So there's a lot of stuff like that going on right now too. I think there's a good motivation for the board. They presented themselves the last couple times in pursuing the legality of what this man up in the Sacramento, that's called the governor, and even the legislators that are up there are in collusion in an attempt to hurt the people that are trying to say, stop this nonsense, because that's what it is. People have to survive. I brought to your attention the pilgrims. They call them the pilgrims. They came to this land 400 years ago. They landed on November 11th, 1620. And today they are struggling 400 years ago after a long, arduous trip that killed people. And then they got off the boat. They signed a compact for their first self-government. That's the beginning of this country. And it wasn't communism because they had to change it because it was a year later. We need to think about how much sense it makes to stop people from trying to survive. And that's what you've been doing. I think you should highly pursue some legal action to stop this governor from doing what he is doing, which is not in the context of the laws of this nation and the laws of this state and the laws of this county. You need to continue to
That's
go
time.
after him.
Thank you for your comments. Gina Mung, and then Gail Rogers.
Thank you, Chairman and Supervisors, for hearing me out today. I've never done anything like this before, but just because of what everybody else has brought up, I'm in complete agreement with my neighbors here, and I am happy to hear from many different people from many different walks of life who are standing up for our common rights, and I'm here to do the same. And as of yet, I haven't heard anybody bring up vaccination, and I know you guys spoke of it earlier, and I know you talked about your efforts to make it more trustworthy for the public by videoing yourselves and medical professionals taking the vaccine. And although I understand those measures are made in order to what you seem as your best interest for the public, I am one of your community members who do not agree with it for various reasons. Don't feel like I need to get into why. Everybody has their choice when it comes to medical procedures, and that's what I would like to continue to see, that things not be mandated or forced upon people, but that people would have their own right to choose what kind of medical procedures are taken in their lives and in their children's lives. And I ask that you would consider not forcing anything like a vaccine upon your community, that you would have that freedom of choice and that I would have the freedom of choice to take it or not to take it. Thank you.
Thank you for your comments. Gail Rogers.
Thank you, Chairman and board members.
That's our lovely governor tell us to go home, by the way.
I'm not a business owner. I recently moved to Chino Hills a year ago, July. But I've been actively working, volunteering my personal time to recall the governor since June. I've done tables at various locations, but just kind of took it upon myself to start hitting the small businesses and walking strip malls, spending hours of my own time doing that. And I have a unique perspective because I've seen many for lease signs, shuttered doors, cleared out places. As I walk by, I think about the people behind those businesses. I think about, who are these people? And if this is all they've done all their lives, now what are they going to do? And are they able to feed their families? Are they, able to pay their rent? And I've also had a chance to talk with business owners as they're signing my recall. There's fear, frustration, anxiety. One gentleman told me that he got the PPP loan, but had to try to make a decision. Do I use it to pay my rent or do I use it to pay my employees? Just a lot of fear and anxiety for these business owners trying to keep up with all the regulations.
having to lay people off and then bring them back on and then lay them off again, and just trying to do their best to survive. And it's been really sad to see these stories that I'm hearing. One thing I wanted to say too was that we hear about cases going up, but which sounds so negative, but we don't hear about the positive. You know, we've learned so much about the virus. The recovery rate is really high. The death rate is low, but the restrictions keep getting harder. So I think like if things seem to be getting better, we're learning more, less people are dying, and the recovery rate is going up. Why are the restrictions getting harder on businesses and just on citizens in general, you know, who just want to live their lives and take personal responsibility for their health? Also, I just wanted to make a point about the vaccine. I will not be taking a mandated vaccine. I believe in personal freedom and the Constitution and liberty and the right to choose for myself and for my family what is best for me. Thank you.
Thank you for your comments. All the requests to speak I have at this point. We're going to close the public comment section, move on to our discussion session. Being this is the first board for Supervisor Cook and Baca, it's kind of short. We actually did already hear item number 56. Item number 57 is postponed to the next meeting. Do we need an official motion on that?
We actually need to open the hearing, see if there's any public comment, close it, and then continue it to.
Okay, so at this point, I'll
15.
open up a public hearing. We're going to request to speak on this item.
There's no,
Okay, we'll close the public hearing and we'll make it, bring it back to the board to make a motion to extend it till December 15th.
So moved.
We got a motion.
Second.
And we got a motion and second. All those in favor? Aye. Thank you. So that item we put off to the 17th, or the next meeting, I'm sorry, the 15th. And we'll bring it back to the board for comments for anybody. We'll start off Supervisor Cook.
Well, it's first week here has been very, very illuminating. And I think everybody knows it's probably the biggest crisis that not just this county, but the country, the world has faced. And it's very, very difficult for somebody. I read quite a bit, but keeping up with the science and how you react to the science to just solve this. You know, I try to be an optimist. I am very, very happy about the fact that the vaccines are going to be available. I think this could be a game changer. I'm not really sure on the implementation. Citizens are concerned about this. And the economic fallout, obviously, I'm concerned about. You hear about it constantly over and over again. And I would hope that the vaccines and more clinical data that's being given to the public and to this board here and other boards and to the staff will help us make the informed decision. I'm not going to, you know, but we've got to get this right. People are in trouble. People are scared. They're worried. It's affecting our educational system, medical system. I can go on and on and on. And so I thought many years ago when I enlisted in the Marine Corps, the challenges I had at that time were enormous, but in many ways, the complexity and if I don't have ulcers, by the way, I'm going to have to have them, I think, or I'm going to have them after the first 6 meetings because it shows that we've got to get it right. So everyone has an opinion, and I think that that's great. It is a democracy. I believe that. I agree with many of the comments. I disagree with some of the others. But that is the way that you voice what is now, as I said, the greatest challenge, ironically, I think that we have faced since December 7th, 1941. So it's been a very, very interesting, challenging week. and looking forward to hopefully, the grace of God, solving some of these tremendous challenges that are facing the county and everybody that lives here. Thank you.
Thank you, Supervisor Rutherford.
Thank you, Mr. Chair. Just wanted to take this opportunity to officially welcome my new colleagues. Delighted to have you both with us. It's been a pleasure to go through the first batch of meetings with you and listen to your questions and see your interest in being engaged. And it is definitely drinking from a fire hose. Despite both of your extreme experiences in government, county is a very unique place. And I know that you'll enjoy the learning process and that your constituents will definitely benefit from what you're learning and the time you're putting in. So welcome to you. Welcome to your staffs. Look forward to productive terms with you. Also wanted to thank everyone who reached out to me as I had to cancel the toy and gift drive that we hold for foster youth in the county this weekend because of the governor's order, but especially thank all those folks who came through with donations anyway. We will still definitely get those out to young people in our county who have needs and appreciate the generosity. That's all, Mr. Chair.
Thank you very much, Supervisor Rao.
Thank you, Mr. Chairman. I'd like to welcome you both. Supervisor Baca, you and I will share parts of San Bernardino County and Colton, and then many of the neighboring valley issues, and I look forward to working with you on those. And Supervisor Cook, you and I will have desert issues that we will work on together as we have in the past, and I look forward to that collaborative effort, and welcome to you both. Thank you.
Supervisor Baca.
Yeah, thank you, Chairman Hagman. I just want to congratulate Colonel Cook again, and then look forward to working with my colleagues as we try to get the county forward. And just, listening to the public comments, I know they're, I hear your frustration. I know the whole country is frustrated. And those you don't know, my day job, prior to becoming a supervisor, was a public school teacher. And clearly I've seen the effects of distance learning and how it impacted our kids, our children. I've seen students dropping out of school, and part of it was for financial reasons, to take care of their families. I hear the small businesses, and I know that, as Colonel Cook said, we want to get it right. We want to make sure that our businesses succeed. We know how important they are to our community. At the same time, we want to make sure our community is safe and making sure they get access to testing. I know the vaccine is going to be put out in stages and based on availability, but those that are willing to participate and take the vaccine, we want to make sure we have an opportunity to provide it for them. And I know some of you mentioned that you would not like to participate in taking the vaccine or be mandated, but I think we have a duty as government to make it readily available for those that do want to take it and do believe it can be helpful. So I look forward to working with all of you on the board and the entire county and community, and being an advocate for the 5th district. So, and I want to thank you for your opinions on the project. I know we're pushing it over for 2 weeks. My staff's here if you have any questions, and would like to reach out to them. Okay, so thank you for your comments. Thank you, Chairman.
Thank you. And again, I want to congratulate both my new colleagues here. The residents of San Bernardino will be greatly served by their experience and their thoughtfulness. And I've had the opportunity to work with them in different roles, and they are great selections for the districts that will be part of this board, and they can contribute a lot. There's a lot going on this month, and I'm hoping that the CEO and staff can come back maybe at the next meeting for a lot of updates. For example, we do have the in the year COVID funds that we need to account for. And I think there's been a number of wonderful projects of our partners of the cities and the school districts, the hospitals, the fire districts. What's our status on some of these and some of the successes that we be able to working together through the community, that we can maybe get updates on the COVID funds. Again, we started off the first county that I know of in California or the United States that recognized the need for the support for our small businesses at the very onset of this with our small business program. How are we looking with the funds there? Is there something else we could do for this last push during the month of December to support them? You've heard many firsthand accounts of the amount of money out of their own pockets to stay open. Transition by the changing rules of this governor left and right, from inside, this is the way you got to do it, to outside, this is the way you got to do it, and now no outside at all. what are some of the things we can learn from these experiences even past COVID? I quite like some of the outdoor dining, past COVID, if you had that choice, but that would take rezoning some of our parking lots and requirements maybe from that perspective of planning, maybe get some lessons learned out of that. We also, for our government now, because of this order, we are now scaling back some of the people we have in our own staff and go back to remote. But what are some of those things we could take away after COVID to keep us being efficient and to attract that younger talent that may want to work remotely and going forward? The vaccination process, even though we have to come up with a local plan, is still being kind of dictated from the state at this point of who gets it, when gets it. But I know that public and the board should be as informed as possible of what those plans are and whether some of the expectations that we may have. I understand that hopefully later on next week, we'll get the official go-ahead for the first round. And I think there's possibly two more manufacturers that are in the key to be for approval coming forward. And the governor said from the very beginning that he's going to basically be in charge of that vaccination distribution, but we need to know and we need to let our residents know what that may be so they can make their plans going forward as well. We heard a couple people talk about citations. Yes, we have a section that you can report businesses that are not following the rules. As far as I know, to date, the county has not fined anyone one dime on those citations. It's not really citations unless you actually find someone. But they are letters to let them know that they may be in not following the state public health guidelines. And that's one of the things we're doing there. Education, talk about that, Supervisor Baca. We need to find out when our kids finally get to go back to school, what we can do as a community, as we can with our partners to accelerate their process to catch up. I heard a study yesterday said that at the best case scenario, most students are at least 6 months behind their education since March. And that's in the best case. And we don't want that to continue. So what can we do to continue to partner up with the superintendent of schools and our other districts throughout the county to try to, when we have that opportunity, get them back on track as quickly as we can and accelerate a period of time. But hopefully we can work together and come up with a plan for that after COVID. And the same thing for economic recovery. We talked a lot about today, but what about next month, the following months? What can we do as economic development team? What are our plans to help all our businesses across and those who found themselves unemployed during this time period to get them re-engaged? We need to double down on work fairs and training opportunities, the Workforce Investment Board, Economic Development Department work for our businesses. What are the plans out there that we can start working with our business leaders throughout the county to partner up with them to get them back on track as sooner the better as possible? We did predict that our rates would go up because we had so many holidays starting back with Halloween. And unfortunately, we've seen the numbers still continue to climb. And as much as I dislike some of the policies coming out of the state as far as directions of closures and what their solutions are, the number one solution we could do, and that's in our own hands, is to continue to wear our mask. We do see our data that the majority of the spread is coming from friends and families, people that we trust, so we don't wear the mask around them. And we all have to have that self-responsibility, hopefully slow down that and do our physical distancing, wear the mask. Besides that, I hope we have a chance to recover as quickly as we can and make amends out of the new situation. Again, congratulations to my new colleagues. And we look forward to our big team here effort to the next chapter of the saga of COVID and what that brings to our county.
Excuse me, Mr. Chairman, my apologies, but I think we need some clarification on item 57. The intent on that was to open the public hearing, receive any comment for which there was none, and then continue the hearing until the 15th.
Okay, so I have to leave it open, in other words. Okay, so we'll go back to item 57. I will remain the public hearing open. We did not have any comments. We did receive a motion, a second to continue it while it's still open until the 15th. And so it'll stay open at that point.
Thank you.